Health equity has been important to me for as long as I can remember. I think I grew up in Liberia. It's a country on the west coast of Africa, and my father was a doctor, and I saw a lot of people struggling to be healthy and to kind of enjoy their lives. I saw a lot of children who didn't have the same advantages I had, so I think I had a sense from a pretty young age about how important it was to be able to afford to live in a safe place and to be able to have medicines and go to the doctor and, get a good education. I had a sense that all of those things were really important because I saw people who didn't have that and who actually had lots of health problems as a result.
Health equity is important in order to change things. You have to be able and willing and ready to do what it is you need to do personally for yourself.
To you. Health equity is important to me because I think people should be able to attain the best health outcome possible for the individual. When I was growing up, I lived in a lower income, middle income family, and health care was considered a luxury or a necessity when you were in bad shape and needed to get health care. So we did not routinely go to the doctor, we didn't receive preventive care, and I think it's very important now that people are able to go to the doctor and receive appropriately delivered care for their situation.
Well, to me, health equity is a matter of justice. It means that regardless of how someone looks or where they live or where they work or what they believe in, they have the opportunity to achieve their best life possible.
Everybody rises with health equity. So what benefit I get, everybody gets. Because when healthcare operates to the benefit of all people, it necessarily works to my interest. The more people are educated about healthcare, the more they're educated about their options, I'm necessarily a beneficiary of that.
Health equity is important to me for two major reasons. The first one is a personal reason. I'm a person living with two chronic diseases, diabetes and hypertension. And as I continue to manage my diseases, I am very adamant about making sure that my treatment with physicians, my treatment with care providers are fair and just, that I'm receiving the same treatment that others are receiving. And because my role as a former community health worker, I understand that when it comes to treatment of any disease, our healthcare system has not been fully equal and just when it comes to serving people of color. So,
health equity is important to me because I want to know that when I'm gone, when I'm no longer here on this earth, that my children and future generations of Americans and humans in general that they'll have an equal opportunity to live the healthiest life they possibly can. And in order to do that, we need people who are dedicated to establishing an infrastructure of research that helps us better dissect what are some of the things that contribute to health equity in general, what'll bring us there. And so to me, I want to dedicate my life and my work to finding out how we can get closer to that.
Every role is important, just like every joint in the body is connected and important to one another.
What I hope to see for health equity in 2017 is the continuation or the improvement on the Affordable Care Act so that pre-existing conditions are still covered, so that people are not afraid to discuss their health issues with their physician in concerns of losing health care coverage.
Well, let me just say this, considering how health will be challenged through the Affordable Care Act and has already been politically. And understanding that policy plays a major issue in supporting health equity. I am hoping that if some of our policies are changed or revised and do not really support a lot of what we have already established in incorporating health equity in healthcare, that roles like mine as a trainer of community health workers and other health providers who understand equitable care continue to push and thrive and make sure that communities, despite certain policies, despite limited or lack of insurance, still really manage and demand equitable health and social determinants of health when managing their care disease.
In 2017, as far as health equity is concerned, I would like to see people take charge of themselves. I would like to see stress lessened on folks and people go back to the basics of remembering what it was they wanted to do with their lives from a little girl or a little boy forward to their senior years. So in 2017, pick up what you're supposed to do, a jump rope, a hula hoop, a skip, a dance, and put a little joy back into your life. There is hope for all of us. So in 2017, let's have a big kickoff and think about ourselves. That is not being selfish, that is helping yourself, and that's what you should want to do.
That we produce research that is impactful, and moreover, we use the research and what we know to inform what we do and the strategies that we employ to help improve the health of everyone.
So I think unfettered access is one of the most important things for 2017, from my view. And I would like to think that that's a holistic view as well, or a universal view. And what I mean by that is when not just people having the option of having great health care and having it available and being able to access it and access it when they need it, but also to have education and prevention included in that.
I hope for health equity, this message, this idea, to be promoted and talked about even more than it already is being talked about. I'd like to see leadership in, our government, in educational institutions, and also in our healthcare organizations be talking about this, and for others to begin doing the work to establish the means of measuring this and to putting that into play. Health equity, in the end, health equity is going to be beautiful because everybody will have equal opportunity to have the best health outcomes they can.
What I hope to see in health equity in 2017 is just more of an awareness of the importance of the issue across the country, across the world. I'd like to hear more people talking about what they can do to make a difference. I'd like to just know that a lot of people from those different walks of life and sectors of society are aware of the importance of everyone having the opportunity to be healthy and are doing something to work towards that. So my goal is to try to bring lots of people together from all those different parts of our society to see what we can do to work together towards that goal.